Yes.
And this is the Committee on Appointments, just for your information.
Yes. So don't just say Honorable Member. That one is called Honorable Dawood. Okay,
My humble apologies for that.
Yes.
I will address them by the names.
Go ahead.
Thank you, Honorable Dawood, for the wonderful questions. First of all, I would like to talk about local production of medicines and consumables. I think that Kenya, we need to embrace this. Local production of medicines, the health products, is really one way to reduce the costs of medication. And so it's an area that we need to embrace as Kenyans, and based on the budget, then we can consider strengthening this. In addition, regarding the NHIF, the universal health care looks at offering accessible care, affordable care, and quality of care to all Kenyans, including the vulnerable and those with disability, among others. And so the issue of only being able to be seen in one hospital is not part of the universal health coverage. And hence, I believe that once we have implemented the UHC, first of all, the community health promoters will be able to improve the prevention, promotion, rehabilitative interventions within the community. So even for cancer cases, they'll be educated on preventive measures, and those who are having terminal illnesses, rehabilitation will be ongoing. Equally, strengthening the primary care networks is critical because it's the first contact and it filters the mild cases, ensuring that the severe cases are the only ones going to the other levels of care, and hence there's reduction in the overwhelming of other levels of care. And so I believe that we can have this as accessible, affordable, quality care by strengthening our community health promoters or the community health programs, as well as the primary care networks, and ensuring that we are offering quality care across all levels of care. So regarding the specializations such as in oncology, as discussed earlier, we have the East Central Southern African College of Physicians, which is a program that is running in multiple hospitals within the country, supporting doctors to specialize. We may also consider having this for other specialists, including the nurses, and see how to see how they can grow career-wise as the health workforce, and that way we can also have access to care. For the doctors at the national team, I believe it will be a consultative approach. I cannot make that decision myself. I believe that it's critical that I involve the whole team, the stakeholders, the partners, and other sectors to be able to see how to address this issue.
Point of order, Speaker. Which issue? And I thought if it is about the commission, health, what is your opinion, nominee minister? If you say consultative, what is your opinion as a leader? Do you support, you don't support, even before you do consultation? What is your input? What is your mind? Yeah, yes. you are running away from being personal.
Yes.
We want to get your suitability, you, not a group, but you. Thank you, Speaker.
Go ahead.
So
the question is, if you are confirmed,
yes,
will you support the creation of the National Health Service Commission? There is some doctor somewhere sending this to all of us.
As part,
ask you.
Thank you, Honorable Chair, and thank you, Honorable Members. As part of the doctors' fraternity, I support the National Health Service Commission. Thank you.
Go ahead, Mary.
The one for level 4 and 5 to move.
I'll help you to answer.
The level 4 and 5, Honorable Dawood, I believe that it's
To be
critical.
fair to the interviewee, even as minister, she has no capacity in law to lift level 4 and 5 from the counties to the national government. It must be a legislation and an agreement between the two levels of government to transfer. So even her opinion here will be relevant. Mary Mase.
Thank you, Chairman. Dr. Debra, I put it to you that for you to be able to realize your policy objectives, you must have adequate or sufficient financing. But when you look at the Ministry of Health, and especially health research, it remains significantly underfunded. And when you look at the budget of the ministry, there's notable dependency on donor funding, especially on research, disease control and management when it comes to control of malaria, HIV, AIDS, name them. My question to you, from your experience in the health space, what are the barriers to achieving optimal funding in health research? Secondly, there are a number of hospitals, if you are approved by Parliament, there are a number of hospitals across the country that have been built through World Bank funding, GOK, and have remained unoperationalized for a number of years. Beautiful structures. Case in point is in my constituency, Amukura. Beautiful structure. They have not been operationalized, no furniture, nothing. So if you are successful, please do an audit of all such hospitals across the country, ensure they have been operationalized so that there's value for money, and before you start building others or advise for others to be put up. I think that the last one, just a comment. Thank you.
Thank you, Honorable Mary, for the wonderful question. I have done a lot of facility assessment, right from the community-based organizations, various facilities at the different levels of care, and also at supporting various countries within the Eastern Southern Africa, as well as the Afro 47 member states supported by WHO. And I'm an advocate for facility assessment. We need to have good capacity, offer quality of care for our patients. And so that will be a top priority for me, to ensure that routine assessment is conducted and that our hospitals are offering quality services. Again, a digital platform would be good to ensure that we are also monitoring and looking at the processes. Yes. So regarding research, indeed, we need to have policies to support research and regulatory. We need to have a regulatory body to look into this. We need to work with the ethics board, among other boards, to ensure that this is aligned. And we have multiple partners who are willing to support in matters research. And so it will be open dialogue, consultation and discussion, and see who can join us to support in the agenda of health research, this being another activity that I wish to undertake.
Thank you, Mr. Speaker. Mr. Speaker, first and foremost, I wish